So today's presentation is on Spina Bifida and Hydrocephalus and the implications for teaching and learning. It's presented by me. My name is Katie Dunphy, and I am the Education and Training Manager with Spina Bifida Hydrocephalus Ireland. And these are our details, which I'll provide again at the end. So today what we're going to be talking about is Spina Bifida as a condition, Hydrocephalus as a condition, and then we're going to do a breakdown of how they can impact teaching and learning in the school environment. So we'll be talking about executive functioning, language interpretation and processing, fine motor skills, visual perception, mathematics, social skills, motivation, behaviour. I'm going to touch on precocious puberty and seizures as well, and then the sport and physical activity modifications that schools can incorporate. Okay, so what is Spina Bifida? Spina Bifida is a condition which affects about 1 in 1,000 children born per year in Ireland. It is the most common of 3 different main types of neural tube defects. So there's anencephaly, which usually affects the head or the brain region. There's encephalocele, which is usually around the back of the neck. And then there's spina bifida, which is from that point downwards, so the spinal cord. So it's the incomplete development of the spinal cord. This usually takes place anytime between day 18, 19, 20 and 28. So it's quite often before a woman even realises she is pregnant. This neural tube can either be fully formed or it could have a minor defect. With spina bifida, some of the vertebrae in the spine are not completely formed, and it can occur in more than one vertebrae, but it is most common around the waist level. So then there are 3 main types of spina bifida. So there is spina bifida occulta, meningocele, and myelomeningocele. So with spina bifida occulta, this is the least symptomatic of the 3. So somebody can have mild to moderate issues when it comes to spina bifida occulta. Some people may even have it and not quite realise until they have damage later on in life or back pain or problems. Then there's meningocele. This one can be difficult for to determine how many issues an individual have, because it depends on the damage and the level of lesion and whether the spinal cord nerves, whether things are impinged. And then there's myelomeningocele. A majority of our members would have or would be in the category of myelomeningocele or meningocele. And here, this is where the spinal cord nerves, coverings, etc., they're usually protruding out to the sac, and that could be open or closed. But there is varying degrees of paralysis and damage caused, in particular with myelomeningocele. So then the effects of spina bifida, they vary enormously. It really depends on the type. So it depends on whether somebody has spina bifida occulta, meningocele, or myelomeningocele. And then it will depend on the location of the cyst. So if it's in the lower region, so the sacrum or coccyx, it can affect the bowel and bladder, sexual functioning. Then if it's in the lumbar region, it can affect the muscles to keep the body upright, legs, knees, feet, ejaculation, as well as the things below. If it's in the thoracic region, it can affect the chest muscles, abdominal muscles, the lower back and hip, and then everything below. And if it's in the cervical region, it can affect the head, neck, shoulders, diaphragm, biceps, wrists, fingers, triceps, as well as everything below. But then, in addition to that, the condition, quite often hydrocephalus is associated with the condition, in particular myelomeningocele. There's varying degrees of paralysis, agnesis of the corpus callosum. Then individuals can develop pressure sores, especially any individual who would be a wheelchair user or would be using splints or AFOs or KFOs. Then there'd be a loss of sensation of lower limbs. Latex allergies can be an issue with a percentage of our members, not all, but it's something that can get worsen over time. So they generally recommend, as much as possible, steering clear of latex products. And anyone who does have a latex allergy needs to be quite careful because it can cause a range of issues depending on the severity of it. Then social and sexual issues are a challenge. And finally, bowel and bladder incontinence. I mentioned bowel and bladder incontinence here because it can affect a huge percentage of our members, because as you can see from the picture of the spine, from the sacroiliac region upwards can be impacted. It can impact bowel and bladder. Then I'm just going to touch on this briefly, and it's leading on from my bowel and bladder, my mentioning of bowel and bladder. Catheterisation is often done in the school environment. It is a clean technique, so it's clean intermittent catheterisation. It's used to empty the bladder several times a day and to keep the bladder and the kidneys healthy and well. So clean in that it is as germ-free as possible. It is not a sterile technique, but it is a clean technique. Intermittent, so it is done on a regular basis, intermittently or several times throughout the day, usually on a schedule. Catheterisation, in that they use a catheter, so a thin tube to drain urine from the bladder. As I mentioned, it's not a sterile technique, but it is a clean one. So it is very important to have good hygiene standards when doing the procedure. So I can talk more about that individually to any school or any parent or anybody else who wants more information on that. But generally, I would add that the parent is the most informed person to teach the practical technique around catheterisation, because the parent is the person who does this on a regular basis. Any additional training would often be theoretical, and this could be done through Tempest Street, Crumlin, or most recently the Cran Centre down in Cork. And this would be the theoretical side of things, and then they quite often show on a mannequin, but they wouldn't show on an individual child, just to put that out there. Okay, so then we move on to hydrocephalus. So hydrocephalus, an old term for hydrocephalus was water in the brain. It isn't a term that's used as often anymore, but it does quite often describe or attempt to describe what is going on. That water, or what it was thought of as a kind of a watery substance, is cerebrospinal fluid, or a CSF. CSF is absorbed into the bloodstream. So adults, we produce about a pint of cerebrospinal fluid daily, and children that little bit less so. But with us, that's absorbed normally on a daily basis back into the body. If the drainage of CSF is prevented at any point, that fluid has nowhere to go. It accumulates inside the ventricles within the brain, and it causes them to swell and causes a bit of compression to the surrounding tissue. So anything that's swelling, that push out, it can cause that little bit of damage. So it's something to be avoided at all costs, or picked up on as soon as possible, as soon as it happens. So it's usually treated by a shunt. So there's a VA shunt or VP shunt are the most common. The VP shunt is the ventriculoperitoneal shunt, and that drains fluid from the brain down into a little cavity just outside the stomach wall called the peritoneal cavity. And there the fluid, or the CSF, is absorbed back into the bloodstream. It is important to note that once hydrocephalus has been detected, the damage to the surrounding tissue, it has occurred, and quite often it's not reversible, but it is managed after that point. Hydrocephalus can occur as a standalone condition in premature births, brain hemorrhage, meningitis or infection, Dandy Walker cyst, tumours, or as a result of an impact to the skull, so an accident, and then it can be genetic. There can be genetic causes. Okay, and then just to mention that the VA shunt is a shunt that's rarely used these days, but it can be used if there is too much damage to the abdominal area for a VP shunt going there, or if there's an existing shunt that is draining fluid from a tumour or a cyst in the brain into the VP, into the peritoneal area, and the body can't absorb it from two places. So that's quite often the time that a VA shunt would be used. So then the type of complications. Shunts are intended to stay in place for life, but like anything that's man-made, it can be prone to failure or shunt malfunction. There can be challenges with over or under draining. And then infections usually will occur within the first few months of a shunt revision or a shunt insertion. So people keep an eye out for those. Then if there's any obstructions from the tubing, from the catheter, from from the brain to the peritoneal cavity area, or they need to lengthen or replace the catheter. So then the symptoms of shunt malfunction, they vary enormously. They vary from child to child, but they're often similar each time for a particular person. Now, this can be sometimes a challenge when a child has had maybe only 1 or 2 shunt revisions and when they're very small to know what their shunt symptoms are. However, there are some that would be more common than others, but that is not a definite. But some of the symptoms of a shunt malfunction would be visual disturbances, decline in academic performance, a decline in motivation, confusion, seizures, sleepiness, incontinence, headaches, vomiting, fever, so swelling or redness on the shunt tract, irritability, ataxia. Now, ataxia you would often see more so in children who are ambulant than children who are wheelchair users, because it can affect their gait, it can affect their walk, and then personality changes. So from speaking with a lot of parents, and this is not these are not the only two for sure, but headaches and vomiting are two of the more common ones, but there can be any of the others. Now, what we would say to schools, and what we would say to parents as well, do not panic as much as possible. So what the first thing we do is inform the next of kin. So contact the parent or grandparent or aunt or whoever the next of kin would be. Then you go directly to the nearest A&E department. You give the A&E medical staff the child shunt alert card, and on the shunt alert card, I'm going to jump forward and then I'll jump back again. On the shunt alert card, it will indicate whether somebody has a VA shunt or a VP shunt. It'll give their name, date of birth, address, but it'll also, on the back, it'll give the neurosurgical hospital, the consultant, telephone, GP's name, and GP's telephone number. These are available from SBHI for any school or for any parent who wants them if they don't already have some. So what you do then, you ask the A&E medical staff to contact the neurosurgical team at CH in Tempest Street as a matter of urgency, and then you get them to speak to a member of the team and not to leave a message. There is a 24-hour neurosurgical team up in Tempest Street, so there shouldn't be any reason not to speak to somebody and to get sorted. Now, one thing I will also add with this is this very rarely happens in the school environment. So I think I have only ever, in my time of working, I'm working with SBHI over 9 years now, and there has been one case where somebody has been rushed to hospital from the school, and another where there was a possibility that it was a slow burner, but that's it in my whole time. It's not to say that it'll never happen, and it's not to say that you shouldn't be mindful of it. But I would also say don't panic too much. Just be very aware of the signs and symptoms of a shunt malfunction. Have a talk to the parents if that child has a specific sign or symptom, and then follow that little guide, and everything should be all right. Now we're on to the teaching and learning implications of spina bifida and hydrocephalus. So the area of the brain affected, it can result in a number of different effects, and there isn't no one-size-fits-all approach to any of our kids. It's like spina bifida is a varying condition, so too is hydrocephalus, and they vary enormously from person to person. However, there are some similarities. So executive functioning can be a challenge, language interpretation and processing, fine motor skills, visual perception, math can be an issue for a good percentage of our members, social skills can be a challenge, motivation, behaviour, and seizures and precocious puberty. So there often is a crossover as well in these the impacts, but also a crossover in how you deal with those. So it might sound like there's a small bit of repetition, but the hope is that it'll be an approach you can take what you need from this presentation. Okay, so with executive functioning, you really have to think of it as the CEO of the brain. So it manages a lot of different things. So things that can be impacted by executive functioning difficulties would be task initiation. So we would sometimes have or get reports back where teachers have said that a child would be sitting in the class just staring and not starting anything. And that's because of executive functioning and poor executive functioning skills. So that task initiation would be a challenge. Impulse or emotion control, organizational skills, flexibility. And by flexibility, I mean flexibility in thought and the ability to jump from one activity to another. Excuse me. Working memory can be a big challenge, and the ability to juggle different pieces of information at the one time. So self-monitoring, and then planning and prioritizing. So that there'd be a crossover in all of those, but executive functioning is a challenge for a lot of our young members. So how it actually impacts, so starting a task, as I mentioned, that task initiation, focusing on the details. So they might either focus very clearly on one detail and not be able to move onto another, and not be able to manage more than one thing at a time. Then time management is often a challenge, and this can be harder, especially as they go on towards secondary school or college, where they need time management skills to manage their workload or their homework. Then work can be quick and messy, or slow and incomplete. And when it's slow and incomplete, it can often be really neat, really tidy, and really pretty, but really slow and incomplete, especially with handwriting, because handwriting is a big challenge for a lot of our young members as well. They can be unable to incorporate feedback, so unable to change something as they're doing it and take in that feedback to make those changes. Difficulties with keeping on task. They often need to be told directions many times, so that repetition and reiteration of instructions. They can have poor decision-making abilities, have challenges switching from activities or multitasking, and often with processing challenges, they will have they will not have the words to explain something in detail. So it's just pulling it from the brain, and will need help processing information. So things that can help. So step-by-step instructions can work very well, because it's very clear. I have to do A, I have to do B, I have to do C. Then a consistent daily routine works very well as well. They're very good in situations where they're familiar and when they can follow a process or a pattern. Queuing in important information, so they know what's important and what's not, because they might not get that what one piece of work is very important, whereas another isn't. Review before new skills. What I mean is, especially with things like maths, that they have to have the concrete, they have to have the starting blocks for it, and then build upon those. And then check in frequently to make sure that they're listening, to make sure that they've understood and that they don't get lost, because that can be a challenge. If they get lost, that's it. If you have to try and pull them all the way back to that point where they got lost, which can be a challenge. Simplifying directions. So directions should be short and snappy. Breaking down complex tasks into smaller workable pieces is definitely one that works very well for our members. Highlighting keywords and ideas. Using visual cues. So using the visuals in things can really help reinforce those with the learning. Encourage to-do lists and checklists. And there's certain sense of fulfillment and being able to follow those instructions and tick something off. It is motivating for them when they feel it's not just one big complicated task that they can't do. If it's broken down into easier pieces, and then there's a little checklist on them, they can tick things off one by one, and it works quite well. And then I have homework diary in there, so that there's good communication between home and school. So if a child is struggling with something at home, that is kind of fed back into the school. It doesn't necessarily have to be a homework diary, but some communication between home and school of what they're struggling in school, that can be reinforced at home, and vice versa. So then language interpretation and processing. It's often thrown out there, this term, the cocktail party syndrome, but it can be especially true for some of our young members. They can have very good vocabulary, but they can have difficulty in understanding phrases or sentences or the deeper meaning to things. And this is where some of our young members their difficulties can often be masked, because they're great little chatters and because they show great verbal ability. They use those skills, and it is a skill. They use that skill to mask some of the other areas that they have difficulty with, and it can be important to know that. So the child's understanding will likely be better in everyday situations. So the more routine and consistent and the kind of stock answer that they can give to be better. But where there's something new, or where there's fewer, if any, clues, they can struggle. And this is where also they can struggle in groups, because there's a lot of rapid fire things happening and they can't keep up, and they can't keep up with that processing. Then lengthy, complex or abstract sentences can be difficult for children with processing problems. So from about second or third onwards, this is where they can start showing real signs of difficulty with language interpretation and processing in the school environment. So with that one, they can have difficulty with gaining meaning from spoken language, expressing their thoughts in verbal form. So this one comes up quite a bit, actually, very subtly comes up quite a bit, where they're not verbalizing how they're feeling or how they're getting on in school. And then when the child comes home, they can often be frustrated or upset or emotional or angry, because they're struggling at something in school, and they can often take it out on those who are closest to them, which is often the parents or the siblings. And the school may not realise that, because they're not able to get their thoughts out in verbal form. Then they can have challenges with labelling objects or recognising labels, understanding jokes, idioms and sarcasm, following long or complicated directions. Again, so that kind of goes hand in hand with executive functioning difficulties. So they can take a long time to respond to a question. They can feel lost when listening to stories with lots of events or characters. And again, this is also one of the reasons why they can have challenges in group and in group conversations. They can be frustrated by feeling they have something to say, but not being able to get those words out, or feeling like it's on the tip of their tongue. And they can demonstrate poor written output and reading comprehension. Reading comprehension can prove to be a big challenge as they move on in class. And they can be very quick to say, I don't know, in response to a question. And actually, just going back to the reading comprehension, where you'll start to find difficulties with a child is when they're being asked questions like the who, what, where, why, when, deeper, especially the why questions within a text, where it isn't very obvious and they can't just pull an answer from the text. They have to have that understanding and that comprehension. That's when it starts to prove difficult too. So what we would say, again, breaking things down into small sections works quite well. Speaking slowly and clearly, unlike what I'm doing now because I'm a little bit nervous. So trying to break it down slowly and clearly. Giving extra time to think, especially when processing is a challenge. Giving the child that extra little bit of time to think would be important, and time to answer. So get those words out. Using visualization techniques, putting the main concepts on the board so that they can follow, and that they learn how to follow storylines, or they learn how to follow what's going on. Using story starters. Try not to overuse words. So using different vocabulary for different words so that they have a broader range, and that they understand different words can have the same meaning. So broadening their vocabulary. Using a cueing system, showing good work versus poor work, so that they can get that feedback and that they understand that a little bit better. And then using multisensory approaches is always one that works well for our members, using lots of different mediums. Okay, so then fine motor skills. So the impact, children can often have awkward or immature pencil grasp. And quite often when children go into school at the age of like 4, 5 or 6, they can have a lot of these challenges. But what the difference is between a lot of those kids and then our members is sometimes our members our young service users, their skills don't improve enormously. They will often carry on these challenges with fine motor. They can have messy, slow drawing, colouring or writing skills. They can often spend a lot of time trying to do it neatly and not trying to do it tidy, or then again, they go fast and messy, but they will have those challenges with writing. They can fatigue quickly when typing or using a mouse, difficulty with scissors, difficulty with performing precise manipulation tasks, so getting those little digits to work. They can dislike hand and eye coordination tasks, and that's where the child can get frustrated or where you might see behaviour challenges. Difficulty mastering new fine motor tasks. So one of the reasons we encourage typewriting skills at an earlier age than a lot of other places would is because it's a fine motor skill and because it's a challenge. It's a new task, so learning it as early as possible, because it might be a skill they'll need later on in 4th, 5th or 6th class. So we encourage a child to start learning even before they really need it, because you have to have that skill set. And then we would say that they tire easily when engaged in fine motor tasks. So if there's an awful lot of taking things down from the board, it can really fatigue a lot of our young members. So you can often see frustration. So if they don't feel they're good at something or good at it and they find it frustrating, it can be really hard to motivate them to do fine motor tasks, especially colouring and writing. This can impact then on behaviour. They can either get emotional from it, or they can get frustrated and angry, or depending on the particular child and their or they can completely avoid it. So it depends on type of child and their type of personality. They can have a good academic ability, but can't get that out. They can't use that. They don't have that fine motor speed. They don't have that processing speed and fine motor speed to get that information down on paper. This can then impact their self-esteem and their self-efficacy, and it can also relate into poor computer skills, because again, that's a fine motor skill and one that needs to be learned. So things that can help. So especially in primary school, there's lots of different ways that you can bring in teaching. So nuts and bolts, using pegs to bring in finger strength, using tweezers, and incorporating learning within all of those. The other things we would say is hand dominance. So encouraging, if they are right-handed or left-handed, to keep the hand dominance, because there will be a lot of crossing over and handing over, especially if they're tired. Bilateral integration. You'll notice there might be a challenge with this if they do not cross their midline. So we would say finger isolation, so working on finger isolation and hand and finger strength, and then experience and reward. So like any child, if they feel like absolutely terrible at doing something and they can't do it, they're less likely to try and keep doing it, So there's trying to incorporate these fine motor skills in multiple different ways. So like it could be Play-Doh, kinetic sand, like I said, nuts and bolts, pegs, tweezers, getting a little spoon and holding like a little flat stone and moving it into a little bottle. Teachers are amazing with ways they can figure out different ways to do things. So and then if that fails, Pinterest is absolutely brilliant. Then visual perception. So many individuals with spina bifida hydrocephalus will have difficulties with visual perception and processing. Now, when you say visual perception, some people have the idea that this is sight relating to their their vision, but in fact, it's the brain's ability to make sense of what the eyes see. So it's how that information is processed. So visual perception skills, they're really important for everyday tasks, things like reading, writing, drawing, completing puzzles, cutting, math problems, dressing, etc. Everyday living will have visual perception and processing skills that we take for granted, but that this can be an area of difficulty for some of our young members. So things that can be difficult for them, so completing puzzles or dot to dot, planning actions in relation to objects around him or her. So some of our young members can seem clumsy. They're not processing what they can see. They might actually see it, but then not see it quickly enough or process it quickly enough. It might appear more clumsy at times than other kids. So then spatial relationships, so things like in, out, under, above, next to, beside, in front of, etc. Then differentiating between B, D, P, and Q, or 6s and 9s, or 5s and 2s can be a challenge sometimes, and that's where there can be problems with writing, especially when there's problems with differentiating. Then they can, as I mentioned, they can reverse numbers or letters when writing. they can lose place quite easily on a page when reading or writing, especially if this coupled with poor fine motor and this coupled with executive functioning challenges. Taking something down from the board is about 5 times harder for some of our young members with spina bifida hydrocephalus than it would be for any mainstream child, in the class, because firstly they have to look up the classroom board, they have to find what it is they have to take down, then they have to try and remember it, so that poor working memory can kick in here, then come back to their page and find where it is they had left off and restart, and then the poor fine motor or the very slow fine motor skill issues when writing something down. So taking something down from the board can be a really tedious and tiring task for some of our young members. So that's something to be mindful of. Okay, and then they can have problems with left and right. They can forget where to start reading, sequencing numbers or letters in words or maths problems. This can be a challenge then, and this is one of the reasons as well why maths can be a challenge later on. And remembering the alphabet and sequence, that can sometimes be an issue for some, not for all. So it can impact reading, writing, drawing, shape, size, volume, direction and position, so that's spatial awareness. Then mathematics is a big challenge as a result of visual perception. Copying things down from the board, as I mentioned, the speed or memory to recall or reproduce information. Then social cues it can actually impact, and this is where social skills can be impacted by visual perception. So that ability to read facial expressions or body language can prove a challenge. Then judging space, so judging slopes, height curbs, width of doors, space in the rooms, etc. And navigating around tables and chairs can be a challenge. Okay, so with maths, this is one that I get a lot of questions about, and get a lot of questions about from parents and from schools on why maths is such a big challenge. So it's a combination really of visual processing challenges, executive functioning challenges, and then language interpretation and processing. All of those can combine into one of the reasons why maths can be an issue. So what can be an issue specifically would be remembering number facts, so addition facts and multiplication tables, using strategies, ideas about spatial relationships and symmetry. And again, that comes from the visual processing and being able to interpret what the brain can see and process it. So identifying different ways to sort objects and using different instruments. And then the big one is problem solving maths. So the minute you start bringing language into maths, it can be a huge, big challenge for our young members. Okay, so what can help? So focusing on understanding, using concrete materials, so things like blocks or pneumacon or other things that, it could be if they're using money, actually using the money, feeling the money, and having a visual representation of like a piggy bank, or, so that they can learn how to count. Starting at a level the child is really comfortable at. So you have to build on it. You have to have your building blocks and build on. There's no point in them starting at a level where they just don't have those concrete building blocks, because they'll struggle and they'll be lost. Providing practice time for new skills or concepts, reducing memorization initially, allowing the use of a calculator, especially as they get on and get older in school. That's a skill that they have to learn as well. So it's one that I bring in again that little bit earlier, so that they have a skill set behind it. Asking lots of questions, so making sure that they understand, allowing them to ask lots of questions and you asking them lots of questions, so that feedback between the two. And making learning a positive experience. So if they get a set against maths, like if they really start to hate it, it'll be like, it would be like pulling teeth for that particular child. It can be really hard to encourage them then to do their maths homework or do maths in class. So trying to make it as positive an experience as possible would be very important from an early age. So as I mentioned, things that can help, so that concrete materials, feeling it and understanding, and different ways. Two things I would always encourage, their life skills. One is telling the time, so learning how to tell the time would be very important, and learning how to use money. They're very important skills for life. So they'd be ones that I'd encourage before you go into algebra or any of these other math concepts. I know at a young age, you wouldn't be doing those anyway at a very early age, but learning life skill maths would be quite important. So then a few other things that can help would be the step-by-step how to break down word problems. So just a step-by-step guide to that. But also then with when you have problem math, knowing different vocabulary or different words for what division, or different ways you can say division, different ways you can say multiplication, different ways you can say subtraction, or different ways you can say addition. So having different wording and having, like, even at the start, having a little cheat sheet so that they know what these different words are, so they can figure it out, and that'll help them learn how to break down a maths problem. Right. Then social skills. So many children with spina bifida hydrocephalus have problems that make it difficult to pick up verbal and non-verbal cues. So as I mentioned before, that language interpretation, that visual perception, and even as well executive functioning, they can all impact the social skills. So what the children can tend to miss out on is the social cues. So body language, reading that body language. So reading facial expressions and when people need you to step back, that could be a challenge. So facial expressions, tone of voice, spatial relationships. So stepping too close or within someone's personal space can be challenging, and one of the social skills that they can have issues with. Abstract concepts, so idioms, sarcasms, and riddles. So I'm not quite getting those. Again, that's the language interpretation and processing. And then self-control skills, so taking turns, letting others speak, and keeping their emotions in check can be something some of our young children with spina bifida hydrocephalus can have issues with, but that'll impact then their social skills and how they get on with their peer group. So how it can, other ways it can impact them, sometimes they can talk too much. They can be great little chatters, but knowing when to talk and when not to talk can be their challenge. Sharing information in inappropriate ways. They can often rely on adults to get information, or will prefer talking to adults than their peers. Some of the reasons for this is adults will give children a lot more time and will be a lot more patient sometimes in their peer group. And also as well, it can be one-to-one talking with an adult, whereas in their peer group, they might have challenges with speaking with a large group of kids, and they might prefer that one-to-one. And kids often don't have the same level of patience that adults would. So but it is very important for them to develop peer bonds. So some of the other reasons it can be impacted is, again, that not understanding facial expressions, not understanding riddles, idioms, and sarcasms, and then that withdrawal from conversations with peers if it gets too much and if it's too hard to process, or if they're just not connecting in those ways. So what we would say is tell them what to do. They don't pick up a lot of these skills inherently, so they have to be told what to do, shown what to do, and provided with feedback. So when they're doing it well, they have to know they're doing it well, so that this is something that they might not realize themselves. Ensure plenty of interaction with peers. This is why as well we would say don't always schedule catheterisation or any particular individual learning around their lunch break or their small break, or their PE, because they can often develop peer bonds in the playground, where there isn't the same kind of level. There is adult supervision, but it's not as structured. So if they aren't in those environments learning at those particular times to engage with their peers, they can often be kind of left out. So it's very important that they have plenty of interaction with peers, either on a one-to-one, a small group, or large group. Buddy or peer mentoring system can be good if the child is struggling or being a little bit left behind. But then providing meaning, so things like role play, imaginative play, social stories work extremely well. They work well for children with autism, and they work very well for some of our young service users as well. And then discussion around things as well. So they might not pick things up. They might, again, back to telling them and showing them how to do it. And then the opportunity to practice those skills is so important. Now, motivation. So the attentional problems that characterise many children with spina bifida hydrocephalus, it tends to be under-identified and under-treated. So with motivation, I hear that sometimes from schools, and I've even heard schools say things like, "Oh, this child was lazy or unmotivated," and that can be, well, it can be a challenge for me to try and explain it. And it can be interpreted as passivity, lack of interest in learning, or poor motivation. So as I mentioned there. But you have to understand where some of the motivation challenges come from. It can be from self-efficacy, so how they feel about themselves, pushing themselves forward. If they've had past experiences of not doing well with something, or of, trying it and getting a knockback, get a knockback, they're not going to feel great about trying to try it again. So if they don't feel good about themselves for pushing forward, they're not as inclined to keep pushing themselves forward for a knockback. Anxiety. Anxiety can be closely connected with spina bifida and hydrocephalus. So if they have anxiety about trying something or doing something, that again can be seen as poor motivation or being passive or lack of interest, when it's just the fear of trying and failing is a big one. Poor social skills. So having a lack of those social skills and knowing when they should or shouldn't can be a challenge. And then executive functioning and working memory. So like I said at the very start, with executive functioning, starting on a task, initiating a task, they can just sit there and not initiate that task. And it's not because they're not interested, and it's not because they don't want to do it. It's because they lack that skill, that task initiative. So that look back and see if they have executive functioning issues, then that can sometimes be seen as motivational issues when it's not actually surely down to motivation. So things that can help. So reducing the workload or the difficulty level would be very important, because if it's too much, if it's overwhelming and overloading, you wouldn't be motivated. I know myself, I wouldn't be motivated to do something if I'm completely overwhelmed and if it's too hard and too much for me. I'd have to either break it down myself bit by bit or reduce the amount that I have on, because you nearly stop, you nearly freeze. And same with our young members. Help to develop habits and routines. So if they have good habits and routines, they'll be less likely to have challenges with executive functioning. So they can, that task initiation or that tick box, can really help. So explaining the task clearly and concisely, breaking the tasks down into smaller, easier pieces. Setting achievable goals is so important. If they don't feel they can achieve these small goals that build up to bigger goals, they won't try. Set an achievable reward structure. So it has to be something that they can actually achieve, or again, they're less likely to try. Give the child a classroom task that highlights the child's ability to his or her peer group. This is so important. If a child is seen as being strong in some areas by his peers, but also internally, if they feel they can do something and do it well, that'll motivate them to try harder in other areas. So pull on their strengths and build on those strengths and get them, working and motivated to work in that way when they feel they can achieve it and they can feel they can do it, and their peers can see that they can do certain things very well. So then behavior. So some children with spina bifida hydrocephalus can exhibit socially unacceptable or challenging behaviour. So what we would encourage is the teachers to consider the why. So behaviour doesn't just happen. There is a reason for it, and to look towards solutions rather than just punishment. Okay, so it can be down to communication difficulties, not being able to get the words out, and then possibly getting frustrated or emotional or another emotional outcome. Then environmental factors. So I remember speaking with one school, and they eventually pinpointed this down to a certain noise at a certain time of the day was aggravating a young child with hydrocephalus who was very sound sensitive, and that resulted in poor behaviour. That child was acting out, but then when they looked back on the how and the why, they figured out that it was down to environmental causes. So some of our young members would be very sound sensitive. So just to be aware of that, as a result of the hydrocephalus, it can impact. So it could be other environmental factors, but that could be one. And their ability. So if they feel that they can't do something or they're poor at something, especially things like fine motor tasks, their behavior might be a way to get out of doing that particular task that they don't feel they're good at. So it could be attention seeking, like many young people or young children. It could be the transition. So it could be the moving from subject to subject, moving from class to class, or moving from break times. That can disrupt and that can cause behavior challenges for some young people. And then physical problems. So if they're not feeling well, so if they're in pain or if they're uncomfortable, or that can impact then on their behavior. So again, it could be physical problems, or it could be down to developmental delay and some of the challenges that go with developmental delay. So what we would encourage schools is to have a look at the ABCs. So the antecedents. So what happened before the onset of the behavior or the problem. So looking at what happened before, then what analysis of the behavior itself to try and prevent reoccurrence, and then an analysis of the consequence of behavior, because sometimes the consequence is what the child actually wants. If the consequence is being taken out of the classroom away from a noise or a sound, away from another child who's bothering them, away from an activity that they don't want to do, that could be the reason they want. That could be what they want. So understanding that could be the consequence, or it could be something else entirely. So analysing what has happened and why can give a breakdown as to how you can prevent it from reoccurring, and looking at solutions rather than just punishment. Okay, then with sport or physical activity. So we would strongly encourage a lot of our young members to take part in sport or physical activity. It's very good for their fine and gross motor skills, their visual perception, spatial awareness, balance, coordination. It's really good as well for peer development, so their social skills and their independence. So I'd strongly encourage sport or physical activity. We would also say that the shunt is very durable advice. Obviously, you'd have to be a little bit careful, but you don't have to totally wrap a child up in cotton wool. They have to be children as well at the end of the day. They can play in a lot of non-contact sports. Now we even have children playing in contact sports, but it's not something I jump out and encourage. But things like swimming, running, jumping, etc., they might need a little help with balancing, but they should be able to at least try a lot of different things. And what I would strongly recommend as well is for schools to contact their local sports partnerships. There's a disability officer in many of those who give great advice, or IWA Sport are absolutely brilliant. They're brilliant at what they do and they give great advice, and they're scattered around the country as well, and they cover regions. So what we would say as well, modify the activity. There's lots of different ways to modify the activity, or modify the space, or modify the game. So the child as well, especially if they're taking part in sport or physical activity outside of the classroom, outside of the school environment, they might have some very good ideas to modify a game or activity. Then ask the class. There's no one as creative as children to come up with new rules or new ideas. So they can be very good to make it a classroom activity. Provide rule reminders as well. So especially with that, the working memory can be a challenge, remembering a load of different rules. So having rule reminders can help. Using visual aids, so things like a little paddle board with a stop and a go, the different things can help when using visual aids. Body up, if injured, so especially if they get a knock to the head, the neck, the stomach, so somewhere along the shunt track, just to keep an eye, and also report that back to home if they have had any injury. But all children are going to get their little knocks and their bumps, and so you don't have to overly worry, but just monitor and report back home. Use safety equipment where recommended, and prevent dehydration. So some of our children with hydrocephalus would need that little bit more water anyway to keep hydrated and keep fluid, both from the hydrocephalus perspective, but also with spina bifida for their bowel and bladder. So keeping child hydrated would be good for learning and for their health and well-being. And then encourage socialization. So I mentioned that at a few points. Now, with seizures. So approximately 1/3 of people with hydrocephalus can have seizures at some time in their life. Sometimes it's an isolated incident, but sometimes they can go on to develop epilepsy. So then with epilepsy, it's usually treated with anticonvulsing drugs, and that's the same for people with or without hydrocephalus. If they have hydrocephalus, so the school would need to know what type of epilepsy the child has, how it impacts them, the medication the child is on, and they should have a specific plan of action if the child has a seizure. So we would always recommend that specific guidelines are in place prior to the child entering the school, or if they have recently developed epilepsy, which can happen with hydrocephalus, that these guidelines are put in place as soon as possible. And we would recommend that school staff working with child with epilepsy have received appropriate training. Now, Epilepsy Ireland are absolutely brilliant. They have a very good resources, and they have very good officers who give great training on different types of medication. So on their website, they have a Managing Chronic Conditions resource and a DVD for schools. I'd highly recommend them to contact them for additional information around epilepsy. Now, precocious puberty. This can be a challenging one. So some children with hydrocephalus, especially girls, can develop puberty as young as the age of 5 or 6. So it can be very, very early, and it can be, as I said there, it can see more often girls than boys. So preparing the child for the onset of periods and sexual development needs to be handled so sensitively. Quite often at that very young age, if they start to show signs at 5 or 6, they would often be brought to an endocrinologist and put on medication to hold it off for a while. But if it does happen early, and even with that medication, it can still happen early, you'd have to be quite mindful that teasing can happen in the school environment. They might not be emotionally ready to go through all those hormonal changes that can happen a little bit later. And if they're already feeling anyway isolated or rejected, or feeling that little bit different to other kids, this can be another thing on top that can be very hard for young people to go through. So it has to be handled so sensitively between home and school as well. Now, then just a wrap up on a lot of those things that I mentioned before. Understanding the specific needs of each child is very important. Every child is different. Every child with spina bifida is different. Every child with hydrocephalus are both just so different. So observing, recognizing, and identifying needs and problem areas as they arise, because they can change. So while they might seem to be okay with a particular area for a while, if that gets more challenging, or if there's new skills brought into it, it can then become a challenge for the child. So just keep re-identifying and recognizing, and keep observing. Select seating partners carefully. So some of our young people can be little chatterboxes, but they can also be distracted easily. So that can be a challenging one for schools, to have them in the right place so that they can see everything, but not too distracted. And encouraging independence where possible. So we would encourage schools to work with family and work with any of the specialists on helping to develop those independent skills as much as possible. So keeping an eye on toileting arrangements and being discreet. So you don't want other kids knowing really what's going on, just that they're going off with an SNA, or going off with somebody to the other kids don't really need to know. So being as discreet as possible to avoid them, sticking out in any way in comparison to their friends. Encouraging correct body posture and use of arms and hands to produce an easy work. So the table should be at a suitable level and wheelchair breaks on. Quite often, especially with spina bifida, occupational therapists are a great resource for the school to link in with, because they will often give great advice on the proper tables to be used, slant boards, or other resources that should be used in the school environment. Then learn to read the body language. So I think every teacher and every parent knows the facial expressions when a child isn't listening or isn't kind of isn't keeping up. So just keep an eye on that and make sure that you keep monitoring, just so that they don't fall behind, and that will indicate if the child has understood it. Okay. And then assume you have to tell the child everything. They might not pick up on the social cues. They might not pick up on the nuances of your voice or your tone. So you have to be quite upfront, or you have to tell the child everything. If you mean something, this is what you mean. Okay, so in conclusion, most of these effects can be reduced through teaching strategies. So there's a lot of things that can help, and schools are brilliant for thinking outside the box and coming up with different ways. But as long as you know that these are some of the areas that might be challenging for some of our young members. So it must also be stressed that the effects, they vary. I think I've said that a few times. They vary from child to child. So some children will have few, if any, problems, and some will have more. So each child is different. So having a good look at your child and knowing your child will be very important. Okay, so I'm going to go back onto this. I'm finished. Oh no. Oh, I'm just after seeing there that it could be stuck on language interpretation slide. So I hope that was did it get resolved. Oh, sure. For anybody, if it stayed stuck, apologies for that. And I'm only after seeing it there, and I have no idea why. Technology there. What I will do, I will send this presentation on to everybody anyway, and I will send the recording on to anybody. And I hope you could hear me, if not see every single one of the slides. So apologies for that. The joy of technology. Is there any other questions for me? So, a few people saying there that they heard and saw most things, and some people said it was stuck, and some people said it was fine. So thank you so very much for listening to me. I know I rapid fire talking, and there's a lot of information in there. And would you believe I used to have this presentation at 70 plus slides, so I had to cut this back a lot. So I hope I didn't cut out anything too important, but I hope I still got all that information in there. So thank you very much, everybody.